Welcome to the Heart of Health Equity. My name is Ashlei Rodgers. I'm the host of the show. And today I have an amazing guest, Tanisshas Harrell, who's the Director of Partner Engagement at San Diego 211. Hello, Tanisha. Go ahead and introduce yourself.
Hello, greetings. Yes, my name is Tanisha Harrell. Everyone affectionately calls me T. I am the Director of Partner Engagement with 211 San Diego, the Community Information Exchange.
Perfect. And so for people who are not familiar with the 211s, it's something that I'm pretty new to after joining Health Leads. I learned about 211 and I didn't realize it was such a great resource and it's different in every city. What exactly does San Diego 211 do?
Essentially what 211 San Diego does is connect individuals to resources within our San Diego and Imperial County. So that is around like community-based organizations, as well as healthcare services. So for example, if someone may need assistance with their energy assistance bill, maybe they've fallen behind or what have you, they could contact 211 to get connected to those resources, to those providers that assist with energy assistance. Energy assistance, like utilities, and as well as food, those are like some of our highest calls that we receive. But I don't necessarily work on that side of the house of 211. So I'm just speaking in terms of information that I'm aware of. I'm on the community information side of the house. And so essentially in my role is to look at what community organizations we need to consider partnering with us to be able to provide like a more wide array of services.
I'm curious, this is a question I ask all my guests. What does health equity mean to you? And especially when we're talking about essential needs and social safety nets, like what does that mean?
Oh, that's a great question. I think there's different like living experiences that I could come from this perspective. I would say health equity to me is access, and it is informed care, it's advocated care. You know, one of the interesting things, my mother didn't have health insurance for a myriad of reasons. She took some time off after my brother passed, and that placed her in what you would consider a category for the government entity that she was working for that did not allow her to have healthcare benefits. She couldn't afford it. And literally like 2 weeks after she passed, the Affordable Health Care Act passed legislation.
Right.
For me right now, I would say health equity is not being lied to.
Yeah, that's interesting how you, first of all, I'm sorry about your brother, because I mean, I know that's hard, and your mom as well. But when you're talking about not being lied to, what do you mean by that?
What I mean by being lied to, it's not like just straight out being lied to, but I've had experiences where I've had to advocate for myself. And if I don't know how to advocate for myself, if I don't know how to ask these questions or even consider that, I consider that just disingenuous engagement. However, I do understand the impacts of our healthcare industry. Like, it's a lot. I'm not the only person that they're serving, but there's only one me. And if I'm not here, then, you know, it impacts my family. And so maybe lying is not the best word, maybe saying like not respecting the fact that even though I don't have a medical degree, I still have a right to be informed.
That's real. And I mean, as people, obviously studies have shown, and we living and breathing, sometimes when you're going to the doctor, they don't always listen to you when you say you're in pain. What is your method of advocating for yourself? Because obviously you go a little bit deeper by learning about the panels and learning about the different parts that affect your health. Some people don't know how to do that, or are afraid to do that, or are intimidated. So what advice do you give people who are trying to, or who are afraid to advocate for themselves in these medical spaces? Like, what do you do?
I was born into this. I come from a family of advocacy. I was diagnosed with SLE, systemic lupus. I lost my vision for 3 years. So I was blind, and I still have, you know, some impact from it years later, but over the time I regained my eyesight. Lupus is something that affects women of color a lot. And I'll be honest with you, a lot of it was derived from stress and how I was treating my body and hustling and trying to not be a statistic as a single mom and raising a young Black boy. into being a young Black man. And so I worked, didn't always, take the best care of myself. And so when I contracted lupus, all that was out there to basically assist me was to treat symptoms. So, with lupus, SLE, you can have diabetes diagnosis, you can have sickle cell. Like, as your body is attacking itself, you get associated with all these different types of proclivities for other autoimmune diseases. And it was monstrous. And I had to advocate for myself and say, hey, I'm not going to continue to take this medicine. It's not helping me. And so I would say one of the things that I learned early on was patient advocacy. And so I would always ask, where's your ombudsman? Who is here to help me understand what this word means that I can't even pronounce? Like, who is available to break down this medication that I'm taking that might adversely affect another medication? And so I had to be ignorant, if I could say it that way, in terms of getting the care and the help that I needed. And it wasn't always easy. I'll be honest with you, I probably was a pain in the butt when it came to my mother, because it was like, listen, I know the doctor comes around at this time, but we need to have a panel. We need to have a discussion, because I'm having to convey what you're saying to me to my family members, and they're not going to be so kind, And so just really advocating and say, I need, all of these people that are treating my mom in the same room, give me a half an hour of your time, and let's break this down,
From my own personal experience, having had sick parents and then having to explain it to my other family members who have no clue about anything in healthcare, some of them still call diabetes the sugars. It's one of those things where you have to be able to break it down in a way that we understand it. So I think that's great. And I feel like we need to write something on that, because I think a lot of everyday folks don't really realize how they can fight for themselves, especially in these spaces where they feel, or they're treated as if they don't know anything, but your body. You know your body. So say something. See something, say something type vibe.
See something, say something. That's right. And I'll even say, even when, as it relates, and it doesn't have to be an adversarial type of thing. It's educate me on your system and how things run. I don't like to just hear well, you have to wait for this. And I understand that, but why is that? Why do I have to wait? And so prior to COVID, I might show up at the discharge social worker's office and just sit there. Hey, whenever you're available.
You just pop up and be like, I got time.
Just pop up. My family and my roots, we come from a collectivist mindset. I grew up with tremendous amount of pressure that how I represented myself and showed up in the world had direct implications to my family and to my community at large. So I couldn't just come in the space as, oh, I'm Tanisha and I'm here to do me. No, what Tanisha did and how Tanisha showed up in the community was a direct representation to my parents, to my grandparents, to my aunts, my uncles, to my neighbors. And so I don't know if that's something that people kind of do these days. And so I would say the advocacy that has been instilled for me is not just for me and my loved ones, it's for my community. Community care is something that I'm really passionate about. And I think community care is health equity, looking at individuals, and those individuals are comprised of many communities. And so if I'm well, then that helps my people be well.
I love it. I'm just heart emoji. Heart emoji tea, because it's real. Everything we do represent. And I also think that as people of color, a lot of times there are not that many of us in spaces. So if we mess up for everyone else behind us. We can't show out, because then none of us will be able to show up in those spaces again.
Man, that part right there. And I used to resist that. I'd be like, listen, I'm my own person. Why I got to represent, And they're like, listen, somebody represented for you to be able to even say that you don't want to represent. So it's when I was younger, I didn't appreciate it, but now I do appreciate it, because I feel a sense of not necessarily responsibility, but accountability to how I'm treating my health, how I'm showing up, how I'm loving on myself, and then also being able to be honest, about some of those things. Because I think oftentimes, chronic diseases or, you know, things that are attributed to people of color and how they eat or where they live, you know, it's like punishing, you know, well, because you're eating collard greens, you know, you're, you know, maybe if you don't eat those collard greens, well, you know, if you got to feed a family of some substance, some collard greens and cornbread can go a long way.
And it's so good. It's so good. I'm from the South. I'm just like, oh, that sounds delicious right now. Yes,
or some hot water cornbread, you know. And I've seen the transition, you know, like I did not like lard, but when I was growing up, everything was cooked with lard.
Yeah.
But the interesting thing is we didn't have all those diseases.
True. I think a lot of now it's a lot of processed foods, which would make a big difference. It's cheaper to eat McDonald's than it is to eat fresh fruits and vegetables at times. Also, like, I feel like I talked about this. Access is a big issue. So you have food deserts and you have food swamps. And for those who don't know what that is, like a food desert is when you're in certain areas of town or neighborhoods where there aren't grocery stores available. And like, and then food swamps is where you have an increase of fast food restaurants around, but no grocery stores. So you'll have like a lot of McDonald's, KFCs, Burger Kings, but there's no grocery store. Or if there is, there's a corner store that may have a few fruits and vegetables, but they're ashy and they're expensive. Those are, and then a lot of times you're finding those in lower income and minority communities. So it's access. And I think a lot of people also need to realize that, you know, if you're a mother with 2 or 3 kids and you just got home from work or you have to take the bus, like you're not going to go, you know, 20 minutes, 30 minutes on a bus to go to the grocery store when you have McDonald's like right down the street. It's just a lot. So I think it's a cultural thing, but it's also an access issue. And I think a lot of times we are faulting those who are lower income and poor, saying like, why don't you, you know, like the soda tax, for example. I mean, the soda tax is a thing, and I don't know if people realize what that was. And you know, is that still happening? I don't know what happened.
It's called a sin tax. So it's like our government determines whether or not certain things are healthy. And if you choose or elect to subscribe to those things, you have to pay a sin tax. And so what that means is, you know, you have your CRV and then you also have your additional tax. And then supposedly from those taxes, they go into social programs to promote. This is America is a special place. You tax something that you have deemed is not healthy for us and overconsumption. And then from that tax, you then create programs to prevent people from eating these things. The dichotomy.
There's so many levels. Like, as we're both sipping our tea, we're like, I said that.
I mean, I had to learn in my young age, I was doing like this nutrition class for like pre-diabetes. And I probably was like, maybe like 25, 26. And there were a lot of like the elders and I was intimidated to do this. And here I am talking to them about nutrition and they have taught me to eat. So rather than coming from a deficit mindset, how can we come from an abundance mindset and take a look at how we're preparing it and how often we're eating it and what is the necessity of us eating it, rather than me coming in there telling them, you know, you're doing it all wrong, or this is resulting into you having diabetes or the sugar.
Yeah, the sugar. The sugars are real. It's a big issue, and a lot of communities, not just Black folks. Like, so we've talked about this before. We're talking about people sharing their lived experiences, and sometimes when people are sharing their lived experience with, especially nonprofits or some of these really big foundations, they're being slightly exploited sometimes, not always, but sometimes people are being exploited. And I feel like it was you that told me this, like, sometimes we're prostituting the pain of other people, which I was shook when I heard that, because I was just like, wow, that's true. Like sometimes these CBOs and nonprofits and foundations, they are expecting these people with these lived experiences to tell all the horrible, horrific things that they experienced in their lives. And then they're like, thank you, this is a great write-up. We're going to put it in the magazine or on the website, and off you go. Meanwhile, the person who's left there, like, I literally just bled for you.
Right.
And you're telling me, thank you, we took your picture, goodbye. Like, what is, I don't know if San Diego 211 is doing something about this, or if you have suggestions of what nonprofits can do to relieve some of that pain that we're causing harm. Like, we're causing some kind of harm when we're expecting people to bleed for us, and then we're not there to like help them bandage it up, you know? And so like, I want to know, just if you want to talk to me about your views on that, because the whole prostituting people's pain, I was like, wow, I was shook.
Yeah, I realized, I've done it, right?
Hmm.
Ignorantly. But then also in terms of like being authentic and showing up, like I'm never ashamed of who I come from, where I come from, um, and who I am today. One of the things that I think in terms of like getting people to share their pain or getting people to share their traumatic lived experiences is being able to provide aftercare. What is it that you need? And sometimes you don't know, when you're authentic, and I'm not coming against anyone else, I'm speaking for Tanisha. When I'm authentic, I don't know that sometimes when I'm leaning in to answer a question, it's going to bring back painful memories or things that sometimes we bury. And so, after I give myself out, or I pour out, I'm left empty, I'm left vulnerable, I'm left feeling, oh my goodness, are these people going to take me serious? Are they going to think I'm just this crying chick all the time, that's always saying, don't forget about the community, and I'm not just talking about the Black community, but don't forget about the community, like our constituents, the people, why we're here. And so, sometimes it may cause me to shrink back. Sometimes it may have me feeling like overly exposed.
And so this is, I think boundaries is like, although this term is not new, it's become a lot more common for people to talk about establishing boundaries. And it's hard when you're working in spaces where people are pulling at you left and right, and it's hard for you to say no. And I know, especially now with the pandemic, people have their families and they have their work and they're trying to keep their job and they're afraid to say no. Like, how do you establish boundaries in a job where you're constantly being asked of something of you?
I think no is something. So I'll be honest with you. I was raised with a lot of responsibility. I was raised to have single parents. And so I would say for me early on in my career, I didn't think I could say no, right? Because to say no means that the opportunity may not be there. But I think once I was diagnosed with systemic lupus and losing my vision, but I learned from that, I was saying yes to everything. I was saying yes to everything because I was trying to make more money so that I could create this financial stability for my child. I also was trying to create space and opportunity for him where I felt like my parents had it provided for me, and just hustling, like going here, going there, and that wears on your body. And then also just seeing like the women and men, the social justice advocates, like going hard, going so hard that, as their bodies begin to fail, as they're, not being able to like rest and give themselves permission to rest. I have that lineage. So now I feel like the greatest gift that I can give to them and those that came before me is to take care of myself so that I could be in this for the long haul and be healthy. How I define healthy, how I see my well-being. And that changes.
I have it because, like, yes, as I mentioned before, like, you are a person that speaks your truth, and you don't even speak the truth just for yourself personally. You speak it for the community. You're also teetering the line of like speaking up and not being quote unquote the angry Black woman, but also speaking up because if you don't speak up, who will? How have you been able to navigate those spaces? Because I mean, people who haven't, who are learning about you today, like you're on a lot of like panels, like you're at different speaking events, like because you are so you're very, very smart. Like you just know a lot of stuff. Like
I've been through a lot.
You've been through a lot, you've lived a lot, you read a lot, like you just know so many things. So people invite you to spaces and sometimes you're not ready for what you have to say because it's all the truth and it's not everybody's ready for the truth, right? So you're mentioning that it's at a price, and that's at a price of like your livelihood because you haven't been able to make as much money as maybe someone who kind of just nodded and said yes to everything, or just kind of like sat at the table and didn't want to ruffle any feathers, so they let things slide. But you don't do that. So what advice do you give other women, and particularly women of color, that want to speak up or are speaking up, but they're feeling the backlash? Like, how have you been able to survive that?
It's been tough. I would say I only encourage people to make that sacrifice where they're willing to deal with the consequences. So I think part of it is because I've seen my family members also take sacrifices and take hits. I learned that. But at the end of the day, I think what it comes down to is the times where I have compromised or I haven't spoken up, I'm not removed from it. Because if I'm advocating for young Black boys, you know, in classrooms, if I'm advocating and championing, it's like I can't afford not to.
Right.
Because that's not just them, they, that's us, that's we.
Yep.
And if it's happening to Malik, it's happening to Juan. And if it's happening to Juan, it's happening to Nugent. You know what I'm saying? So it's like, I don't know any other way to be. And it doesn't feel good. It sucks. Sometimes we don't know what we want or what we need. We don't give ourselves permission to do that. And I hadn't realized that I did not do that. And so when people would come to me and say, T, how can I help you? And I'm like, you know what? It'll take me more work for me to figure out how you can help me or where I'm willing to trust you to help me than it is for me to just do it. Yeah. And so I had to start examining that and saying, you know what? You can help me here. Because sometimes when you're accused of being an angry Black woman, and I've been accused of that a lot.
You know, I'm like super friendly, and I've also been accused as being an angry Black woman. So it happens to all of us.
It does. But you know what? I embrace it. I am angry. I'm angry about injustice. I'm angry that, you know, people don't get to show up as their authentic selves and they're penalized because they don't look like you, or they're penalized because they don't fit into the structure. So if you want to consider me angry, I am angry, but I'm also loving. I'm also kind. I'm also compassionate. So, you know, I think I learned to kind of like, if that's where you see me, that's cool and everything. But I would say I'm really learning to take it each day at a time. I'm learning to create a different morning ritual. What serves me? Is it breathing? Is it listening to my Shine app? You know, is it meditating? I couldn't get into meditation for a while because it just didn't seem afforded to me. But it's something that people of color do it all the time. We just call it different things. We call it grounding. And so how is it that I can wake up slowly and rise and present myself into my day? How is it that I can pay attention to my breathing and understand that when I'm taking in this information, it's having an effect on my body?
That's like wisdom. Auntie T.
I'm telling you, the day I seen you and you showed up, I was like, yes, come on up in here with that red lipstick with your beautiful chocolate skin.
I'm just thankful that it's like we're our ancestors' wildest dreams, right? Like our moms would have never thought they could do these type of things and speak our truth and be online and people listen and all that type of stuff. So I'm just thankful. I'm thankful for those who have sacrificed a lot.
Yeah.
A lot. Blood, sweat, tears, everything.
So all of that.
Be here, learn, and you are continue. Like I'm just so thankful because you continue to pour like into so many people, and I don't think you realize how much you pour into people just by being you. I remember our first interaction. I was just like, "Who is this woman? What's happened?" I left there like, "Oh my god! Like I love her. Who is she?" And I'm hoping that people who are watching this today can feel that vibe from you because this is her all day, every day. This is not her trying to be cute on camera. No. This is T. And
listen, I will take this off in a minute. It doesn't matter because, you know, I think what you're doing and having these conversations, and I listen, like Ray Foss, you know, like, man, I think what Health Leads is doing and bringing, I've never really wanted to like be in front of the camera like that. And so this is me being brave as well, because I love one-on-ones, you know, but to put myself out there, it's time. And because you know what? It's like when that young girl seen Michelle Obama, right?
Yes, it's such a cute little picture.
You know, representation matters. But I don't want to, I want to be like my brother Malcolm Malik says, representation just here and not representation here. Like I'm not trying to be a fraud. And so I hold people to hold me accountable. And, you know, wherever I've caused hurt and harm, I have. But I have an opportunity to learn from that. And
we're all learning. We're all learning. We're all growing every day. And I think the first thing is for us to acknowledge where we have fallen short so we can continue to grow.
Yeah.
And also being vulnerable. And I appreciate you being on this show and being your true authentic self always, but especially here in front of the camera, because I know it's hard. And just speaking your truth and speaking the truth for so many people, because there are folks who will never know their value, may not know their value and their worth, right? And then seeing people like you and me on here saying like, look, like imposter syndrome, throw that stuff out the window because you was kind, you was smart, you is important. And I appreciate that because you, Auntie T, like this is who you are. So T, working for a nonprofit and advocating for others can be extremely taxing on one's mind, body, and spirit. What are you doing for your own self-care? Because I feel like you are constantly giving, and how are you pouring back into your own cup?
Honestly, I have days where I do nothing days. Do nothing but absolutely what I want to do. Sometimes, you know, we look at self-care on the outside of us. It might be a pedicure or things of that nature. But like one of the things that I've been leaning into in this pandemic is a wise woman told me, she said, the most important thing that we have to get through this pandemic is keeping our humanity intact. And for me, keeping my humanity intact is love. And so I'm learning to love myself differently. I'm learning to be intentional with carving out time for Tanissha. So if that means getting up off that Zoom call and then taking a quick, you know, walk around the park or walk around my apartment complex, or it might be shaking my shimmy or whatever, or, you know, but what is going to make me laugh? What is going to make me release? And what's going to water me? I know we say this all the time, love ourselves, but that looks differently. You know, sometimes we just gotta.
A nice little hug, real talk, real.
And then kiss ourselves, you know, and just say, I'm here today, I'm showing up. And I think, you know, this thing about professionalism, I think, you know, I think it's okay to show up and say, you know what, I'm low energy today. You know, I think it's okay. And in those spaces where it may not be okay, you know, I've had women of color, because I wore my hair in Bantu knots, saying, you know, why are you coming in here with them, you know?
Yeah.
And I'm like, because this is,
but
you know, this is who I am. And you may not like it and you may think it's an affront to you, but this is me.
And you're being authentic. And I think a lot of times we haven't been authentic to ourselves. And even just now, recently, Black women feel comfortable wearing their natural hair to work. For the longest time, we were shamed and saying that we have to have it straightened or covered in a wig or whatever. And I'm hoping this woman that you spoke to has changed that perception, because it's self-love as well, where we're loving our natural selves.
And I love her, and I get what she was trying to say to me. She was trying to help me with what she knew got her where she was. But that wasn't my plot. And so I would say also, like, part of loving on yourself is accepting, because you can see my hair wrapped up now, but I might decide to go straight. Whatever we do, it's all good. You know, and I'm really excited to see the Crown Act, because when I was coming up and I was, you know, working and wearing braids and wearing afros, you know, I was told those things were unprofessional.
I mean, it's just happened. Like I was rocking a fro like 5 years ago, and you would get side eye sometimes. You're like, whatever. Like it's hard. Like we can't be our true selves at work. I'm hoping the Crown Act passes. I hope it becomes a federal law.
Yeah.
Now I think it's in like different states. Because it's a shame that we can't wear our natural hair. Safe in spaces with our own hair. So T, like, you know, you're constantly fighting the good fight. What is your approach to having those tough conversations about racism and inequality?
There's this concept called the ho'oponopono. You know, I love you, please forgive me, and thank you. And like, you know, I used to be like, rah, rah, rah. You've already shown me who you are. And until you're ready to show me something different, I'm going to match my energy with your energy. And that's not tit for tat. That's just saying, like, I don't have time to be wasting my energy of love in spaces that don't want to receive it. It doesn't mean I don't love you. It just means I'm going to match my energy for your energy. So I would say choose your battles, because some dinosaurs, they're just not ready to be extinct. But one day they will. and we need you to be breathing so that that new breath can come. So I would say, you know, back in the day when I was young, I would go toe to toe. I had to learn diplomacy. I had to learn it's not always what you say, but how you say it. In my younger days, I considered anything other than raw and 100%, it was being fake. And so with diplomacy, it taught me how to see things from other people's you know, their way of looking at it. But it doesn't mean I necessarily have to agree with it. But now I know. And then I try and find not necessarily like-minded, but other individuals that, you know, see, this is not okay. This is not okay. And so I would say one of the beautiful things that we've witnessed, and it's not the first time, but I can't breathe. Calling out for your mama. I don't care, anybody that has any kind of mothering, to put yourself in that situation and think, this is someone calling out for their mama. And just because you have committed crime or allegedly committed crimes does not mean that you don't have any human value. So I would say, you know, now I get pissed off. I'll be honest with you. I get more so pissed off of when it's done to others and they may not feel like they have the advocacy to speak up. But listen, I have a saying, I'll eat beans and rice, I'll eat tortillas, I'll eat top ramen, but you cannot have my human dignity. You can't have it.
T, thank you. Thank you so much for being here. Thank you guys for reviewing The Heart of Health Equity. Check us out on our next episode, and find Tanisha online. She's definitely on LinkedIn and Facebook and at San Diego 211. Thank you. Bye-bye.
Thank you. Bye-bye.